So,
I'm really pissed at the way the press is reporting coronavirus.
Okay,
here's what the headlines are saying. The headlines are, oh my God, there's tens of thousands of more cases than we knew. There's so many more coronavirus infections. The headline should be, in spite of there being many, many tens of thousands of more cases, it's milder than we ever knew and only 300 people have died. Worry about the flu. That will kill you.
You think that's way worse?
Influenza is way more likely to kill you. Way more. Get your flu shots.
Is that right?
In spite of this being milder and more widespread than we ever knew, the press is misreporting this and it pisses me off.
Up until recently, coronaviruses were like mild things. They were just common cold. Just next slide. In fact, those are all different kinds of viruses. The ones with the red circle around them are the 4 viruses that cause the common cold. That was until 2002. Then we got a big surprise. And the surprise was, next, is that we had the severe acute respiratory syndrome, and that was SARS. Multiple years later, we got the Middle East respiratory syndrome. But a story that you may remember, next slide. In China, in the Guangdong province, the sort of history repeats itself, right, Mr. President.
Right.
In China, in the Guangdong province, there was this strange disease that came up that nobody knew what it was. The Chinese didn't really tell anybody about it for a few months, November until it got to Hong Kong. When it got to Hong Kong, and this is what happened. There were 8,000 cases, 774 deaths, and that's how I get the number that I've been telling you, that the mortality of SARS was about 9 to 10%. If you do that math, that's what it is.
Wow.
Right. Next slide. The other one is the MERS coronavirus, which was the one that was in Saudi Arabia. That was also from an animal reservoir. Next
has shown that while COVID-19 is more transmissible, it's not as deadly as recent outbreaks like SARS in 2003 and MERS in 2012. The report published details of more than 44,000 confirmed cases in China, the biggest study since the outbreak began. The findings put the overall death rate of COVID-19 at 2.3%. There were no cases of mortality for children under 9 in the study, while those from ages 10 through to 39 had a 0.2% mortality rate. Ages 40 to 49 had a 0.4% mortality rate. Ages 50 to 59 had a 1.3% mortality rate. Ages 60 to 69 had a 3.6% mortality rate. Ages 70 to 79 had an 8% mortality rate. Ages 80 plus had a 14.8% mortality rate. Looking at the sex ratio, men are more likely to die with a 2.8% mortality rate compared to women with a rate of 1.7%.
Diamond Princess cruise ship, which is where my next guest contracted the coronavirus. Joining me now is Carl Goldman. He was a passenger on that ship and is now under quarantine at the University of Nebraska Medical Center. Carl, how are you feeling, my dear? My goodness, sorry about what you've been through. How do you feel?
Thanks, Laura. It's been a bit of an ordeal, but I feel fine. This virus for me was pretty light, about equal to a very, very mild cold. And today I'm feeling fine. Unfortunately, I'm still testing positive. And so I'm going to be stuck here for a while longer.
So, Dr. Drew, are we overreacting?
Yes. Yes. Yes.
I'm hearing this from doctors left and right.
Yes, and we are not overreacting. The press is overreacting, and it makes me furious. The press should not be reporting medical stories as though they know how to report it. If we have a pandemic, I won't know how to tell that we're actually having a pandemic because everything is an emergency. People that are infectious disease specialists, the CDC, the epidemiologists, need to take this very seriously. The press needs to shut up because you're more likely to die of influenza right now.
We know that if you are older, if you have medical comorbidities such as diabetes, heart disease, or lung disease, you are at higher risk. But I want to give you some perspective really quickly. 18,000 people have died of the flu in this country this year so far. And as you mentioned at the top, 11 people have died from coronavirus. And while our hearts go out to each and every family who's lost an individual, it's important that we keep things in perspective and we recognize that we can do
250 people a month die from aspirin. That's 10 times the amount of coronavirus. Look at iatrogenic deaths, 20,000. This means deaths from medical treatment, whether it's mistakes from surgery, medication, or getting some infection in the hospital that you die. 20,000 people a month die from this. And this is just in the United States. And these other ones are global, okay? Check this out. The flu, influenza, 38,000 people a month die from influenza. Look, compare this to the coronavirus. It doesn't even compare. But the news is blowing this so far out of proportion. Why don't they talk about this, or even that? There's a little bit of a distortion of what they should be emphasizing. And also, all the stress that's created from the news and the panic is going to cause people to get in car accidents and increase this rate, not to mention more stress for the heart. The only point I'm trying to make is you have to put things in the right
proportion. Let me frame it this way.
proportion.
We have, in the United States, 24 million cases of flu-like illness, 180,000 hospitalizations, 16,000 dead from influenza. Why is that not being reported? Why isn't the message, get your flu shot? We have 0 deaths from coronavirus. We have almost no cases. It's coming here. That community transmitted case you reported on from UC Davis, that means that it's far milder than we know it is. And there are people walking around out there with the virus that don't even know they have it. It's so mild. So it's going to be much more widespread than we knew. It's going to be much milder than we knew. The 1.7% fatality rate is going to fall. Where was the press during the Mediterranean corona outbreak when the fatality rate was 41%? If they wanted to get crazed about something, why didn't they get crazed about MERS or SARS? This is an overblown, press-created hysteria.
What do you think about face masks?
Well, it's important for folks to know that face masks are not recommended for the general public. There are 2 things people should know. Number one, if you wear a face mask and you're not wearing it properly, you're going to be more likely to touch your face, and you can actually increase your risk of getting a respiratory disease like coronavirus or flu. Number 2, when people hoard masks, they are not available for healthcare providers who actually need them. So my advice to folks, stop buying masks. If you're part of the general public, leave them for the healthcare providers so they can take care of people who are sick.
I was reading about a couple of universities.